Welcome to this webinar on unlocking safely COVID support and guidance for businesses with Birmingham City Council. I'm Raj Kandola, Head of Policy at the Greater Birmingham Chambers of Commerce. I'd like to welcome you all to today's event. Next slide, please, Jess. Now, as we know, business confidence is building in certain sectors as national restrictions ease, but we also are aware of the fact that we need to maintain the stem of the virus whilst also ensuring that businesses have the tools that they need to prosper in the long term. And that's what we're really here to talk about today. So in terms of the format for today's webinar, I'll very shortly run through some slides around the support mechanisms which are in place for businesses right now and how they can be accessed. And then I'll hand over to Dr. Julia Duke-McRae, who's a consultant in public health, test and trace, Birmingham City Council. We'll talk about the latest updates on COVID-19 in Birmingham and the best practice advice and guidance on COVID safety in the workplace. We'll then hear from Abby Vlakis, the CEO of Millennium Point, who will talk about how her organisation has adapted to COVID-19, as I said, putting those plans in place to prosper in the long term. After those presentations, that should leave us around about 20 minutes for a Q&A section. And again, if you've got any specific questions, feel free to leave them in the chat box, and I'll direct those questions to the relevant speaker. And we should be aiming to finish around about 12 o'clock. But again, if you've got any specific questions that we don't have time to answer in this hour, please feel free to email them to our team and we can pick them up afterwards. Next slide, please. So I'll very quickly run through just some background information into what the Chamber's been doing throughout the pandemic before we go on to the support mechanisms which are available for businesses that have been affected by COVID-19. And I think really it's the Chamber's role in this pandemic has been very much around keeping business moving. And I think the work that we've done really reflects the ethos of the Chamber in the sense that throughout the pandemic, we've been there to help businesses connect, support, grow. So in terms of connecting, we've been trying to help businesses connect with other businesses via highlighting the member-to-member offers. When it comes to support, we've had our COVID-19 hub, which again showcases all the various support mechanisms in place for businesses right now and how you can access them, and I'll come on to that shortly. Running informative webinars such as this one. We still have our free legal and HR helpline where Chamber members can access the service via their relationship manager. A big piece of work has been around lobbying and campaigning activity, particularly helping those businesses that have been impacted by the pandemic and ensuring they have the right level of support. And from a grow perspective, we still had all the thought leadership content, so asking businesses to provide blog posts and videos on how they responded to the crisis and adapted. And of course, we still have our daily news articles, which again go out to over 16,000 subscribers. Next slide, please. And I thought it'd be good just to summarize the work that we've done in relation to those points I've just made. So between March 2020 and June 2021, as you can see, just over 200 top stories in Chamberlink Daily on the latest COVID-19 business news, just under 19,000 calls made by Chamber employee to local businesses, almost 3,000 hours of phone support provided to local businesses. You can see there just under 23,000 views of the coronavirus pages on the Chamber website, 186 webinars which have been delivered for over 6,300 delegates. And of course, we have our KBM inbox, in which 480 businesses have contacted us asking for support. Next slide, please. So, as we know, stage 4 of the government roadmap has been delayed for up to 4 weeks, which is now due to go live on the 19th of July. As we know, the government hopes to remove all legal limits on social contact and reopen remaining venues such as nightclubs and enabling large events to go ahead without capacity limits. As we know, in the last couple of weeks, Birmingham has been designated as an area of enhanced support in order to tackle the rise in cases related to the Delta variant, which again, I'm sure we'll come on to later on. Next slide, please. So in terms of specific support mechanisms, the Restart grant, I'd say, is one of the big offers on the table. So as we know, one-off cash grants of up to £6,000 for businesses in the non-essential retail sector, businesses in the following sectors such as hospitality, accommodation, leisure, personal care and gyms can claim up to £18,000 depending on their rateable value. To be eligible, you must be a ratepayer and your business needs to have been trading on the 1st of April of this year. The grants are being distributed by Birmingham City Council. and you will need to register for a Brum account to apply for a grant. Now, I should say that the applications close at the end of June, and all awards will be made by the end of July. Next slide, please. The additional restrictions grant. So this was a grant which has been allocated funding to support those businesses impacted by those businesses, that are not covered by the grant scheme, such as those that don't pay their rates. And the eligibility criteria is determined by the local authority. There's also a domestic support fund, which provides financial support to not-for-profit organisations and charities hosting UK meetings, conferences and events taking place from the 21st of June to the 17th of December. Organisations can apply for up to £30 per delegate attending an event, and you can complete an application form via the Visit Britain website. Next slide, please. Of course, the coronavirus job retention scheme has been so important in safeguarding thousands of jobs across the country. It's also known as the furlough scheme. It's been extended until the 30th of September, but we should point out that in July, employers will be required to pay 10%, with the government paying 70%. And from the 1st of August to the 30th of September, employers will be required to pay 20%, with the government paying 60%. We also have the Self-Employed Income Support Scheme, or SEAS as it's known, which is the claims for the fourth grant have now closed. There will be a fifth grant, which is covering the period from May 2021 to September 2021, and applicants will be able to make a claim from late July. Next slide, please. We also have the Recovery Loan Scheme, which replaced CBILS and the Bounce Back Loan Schemes, in which firms can access loans and other types of finance up to £10 million until the end of this year. The loan repayment period is up to 6 years, and businesses are required to meet the interest payments from the outset, unlike the bounce back loans. And businesses have until the end of December to apply. We should also point out the business rates holiday. So businesses in the retail, leisure and hospitality sectors can claim 100% business rates relief until the end of June. Now this will change to 66% from the 1st of July, and that will run until the 31st of March of next year. Next slide, please. Now there's lots of other information on universal credit, test and trace support payments, statutory sick pay, temporary VAT reductions, but also information on the Kickstart scheme, which you'll find on our COVID-19 hub on the website. So if you go to the website, you'll see a link on there, which again, information is set out about the various support mechanisms in place, how businesses can access them, and when they're available from. So please do visit our website for more details. Next slide, please. And just to finish off before I hand over to our speakers, there are a number of lobbying points that we're calling for right now to help those businesses that have been impacted by the remaining restrictions. So one thing relates to reviewing the planned reduction in government contribution to furlough payments from the 1st of July. We are concerned about the impact that this will have on overheads for a number of businesses that are struggling right now. We'd also like to see a top-up of the additional restrictions grant to support those local authorities who can then direct further support for the most impacted businesses. So for example, non-rate payers aren't eligible to access the restart grants, and that's something we'd like to see change. And of course, we'd like to see a government-backed insurance scheme for live events to support confidence in the sector moving forward. So that's it from me. I'll wrap up there, and I will now bring in Julia. Julia, over to you.
Right. Hi, everyone. I'm Julia Duke-McCrae, consultant in public health. It's great to be here today. So what I'll do is just go through the updates around the COVID cases, and then a brief outline on the guidance. Next slide, please. So we've seen, in the last 7 days, we've seen case increase by about 44.6%, and the current case rate is 186.4 cases per 100,000 population. The positivity is 3.2%, and that's increased as well. And with the, as the businesses opened up, we've seen an increase in rates of hospital and ITU admissions. And this has increased to double figures recently. So across the board, I mean, it's affected all ages basically, and the highest increase has been seen in the 0 to 19-year-old and the 20 to 39 years old, with the highest in the 20 to 39. Recently, I mean, in this last 7 days, we've seen a decrease in the 60 to 79-year-old case rates. Now, what we've seen across the city has been varied case rates across different wards. So some wards have higher case rates than others. We've seen differences around age groups and around ethnic groups. Now, we looked at 3 different indicators to decide which wards we should focus on. And that was around the wards with the highest case rates, the wards with the low testing rates, and then the wards with the low vaccine uptake. What you have on the slides are the different wards. There are 15 of them, and I'll talk about this later on. Next slide, please. As you can see, just as I said, the highest case rate has been in the age group 10 to 19 and the 20 to 29. We've seen a slight decrease in the 60 to 69 in the last 7 days. Next slide, please. Also, our ethnicity has been, in the last 7 days, we've seen a sharp rise among the Black ethnic groups and the lowest in the white ethnic groups. However, we've also seen the next highest rate has been in the mixed and other ethnic groups. Next slide. As you can see, we have seen a surge in the Delta variant, which appears now to be all over the city, and that has taken over the Alpha variant. And most of these cases are seen in the west, central, and southeast of the city. And this, in the west part of the city, that's where you have particularly low uptake rates in the vaccine and low testing rates as well. Now, with this, with the high cases in that particular ward and the low vaccine uptake, you're likely to see more serious illness appearing in that particular part of the ward. Next slide. Now, this gives an overview of the trends in vaccine uptake among the 18 and over for the first and second dose. As you can see, it's a similar pattern to England, but we're still way behind the England average right across first and second dose. We still have quite a lot of people who have not been vaccinated. So for the first dose, you have over 380,000 people still unvaccinated. For the second dose, over 500,000. Now for the 50 plus age group, you have over 61,000 cases of people still unvaccinated. And those are the high risk groups who are likely to become severely ill from the virus itself. Next slide, please. So based on this, with the high surge of the Delta variants and low uptake rates in vaccine and low testing rates, Birmingham has become an area of enhanced support. Now, the Delta variant itself, why we are really concerned about it is because it is more transmissible and it affects the younger age groups, as we've seen. There have been other areas across England where we've had where they've been also an enhanced support, and we've learned from them. And what we've seen is that there are 3 main areas to focus on, which is the testing, isolation, and vaccination. And all 3 areas have to be done about the same time. It cannot be done singly. Now, what does the enhanced support package mean? It aims to suppress the spread of the Delta variant and break the chain in transmission by stopping rise in the number of cases we see. Next slide. So really speaking, the focus on those wards I mentioned earlier on is mainly because of the high case rates, low testing rates, and the low vaccination uptake among those wards. And what we're planning to do with the enhanced support package is to increase the vaccination uptake, increase testing, and support those who will be social isolating, alongside enforcement of current legislation. So in terms of the testing support, there'll be door-to-door lateral flow testing across the city. Reminder that people have to test twice weekly. And then if there's an outbreak cluster outbreak in workplaces, there'll be search testing in those areas as well. Now, the self-isolation support, we are encouraging adherence to social isolation based on the guidelines. The environmental or health officers will support the compliance of this through enhanced contact tracing. They will be going around checking to ensure that people are isolating where they're supposed to be. And then there'll be support, they'll signpost people to during the isolation periods for emergency response. And that will be the isolation package they will receive. Now, in terms of the vaccination uptake, we encourage people who are eligible and offered vaccination to attend and receive their vaccination. And then we'll be targeting those low uptake communities and through a mobile van right across the city. There are community voices and citywide vaccination toolkits providing more information around vaccination and to increase awareness about vaccination and whatever concerns people may have. There's also the pop-up clinics, which are right across the city, and there is a schedule which I'll talk about in the next slide. Next slide, please. Now, when you look through with the enhanced support, there is now a walk-in appointment for vaccination, which is now available. So for the under 40, from Wednesday to Sunday, 10 a.m. to 4 p.m. at the Millennium Point and Aston Villa Football Club. For those over 40, and the Baston Cricket Ground, Sundays 10 to 4 p.m. And then the whole secondary schools for those over 18 from 9:30 in the morning to 3:30. Now, there are other venues for walk-in, which the links are just below the slide. Next slide, please. Now, everyone has responsibility to ensure that we do not have a continuous surge in the cases. Now, for employers, you have a duty to protect people, not just your staff, but all your customers and visitors to your organization. And the guidance says that you must identify what work activity or situations might cause transmission of the virus, to think about who could be at risk, and decide how it is likely that that person could be exposed, and then act to remove either the activity or situations, or if it is impossible, to contain the risk. Next slide. So the guidelines flags up about 8 steps that people can take to provide a COVID safety environment for their staff and customers as well as visitors. Now, you will need to complete a COVID risk assessment, which will help manage the risk and protect people who come to your establishment. The link is there on how to do this risk assessment. You must ensure that all surfaces that people are likely to touch remains clean at all times, and the cleaning process has to be continuous. There should be availability of hand washing, and if that is not available, then hand sanitizer should be used. They should be put at the entrance and exit of your establishment. Then to remind customers and staff to wear face covering in any indoor event or where the law says they must do this. Make sure that everyone can maintain social distances, and where this is not possible, have a one way in and another way out of the establishment. Then it's important that you maintain adequate ventilation by opening windows, and take part in the NHS test and trace by ensuring that anyone who comes to your establishment, their contact details are taken, and then that you display the NHS QR code poster quite clearly. Now, if you find anyone who has symptoms of COVID, you must send them away. And then you must remind your staff that they must test twice a week. And if they are positive, they need to inform you, and they and members of their household need to self-isolate. Next slide, please. Now, as a key take-home message, we must all remember that we all have responsibility to ensure that Birmingham remains a safe city. So we'll continue with the meeting people outside rather than indoors, wherever that is possible. And we must follow the COVID safety rules, which is hand washing, face covering, maintaining social distancing, and having windows open where possible for fresh air. We must get ourselves vaccinated when invited to, and maintain the social distancing and all the COVID measures, safety measures. Now, it doesn't mean that once you're vaccinated, which a lot of people think that you completely you cannot spread the virus. So you must actually maintain face covering when you're outside, and continue with this COVID safety measures. And you must also continue to do the twice a week testing. And if you have symptoms, you must go ahead and do a confirmation test and self-isolate. Next slide. So these are the other useful information and guidelines which I have included here, where people could get some more information that they require. Thank you.
Thank you, Julia, for a really fascinating presentation. Lots of really insightful data and lots of tips as well. I think just a reminder of some of the challenges that remain on the horizon for all of us, and the role that we collectively have to play as we look to emerge from this crisis. So thank you very much for that. I'd now like to bring in Abby Vlakis, CEO of Millennium Point and Chamber Patron, I should add. As I said, Abby's going to touch upon some of the practical challenges that the organisations have faced in not only adhering to the guidelines, but also looking to put the steps in place to return to some form of normalcy and hopefully prosper in the long term. So Abby, over to you.
Hey everyone, thanks Raj. Can everyone, yeah, I'm on, yeah, great. So lovely to be here today. Just want to give you really an idea of what we've faced here at Millennium Point, and what we're doing in terms of looking to the future. So for all of you who know Millennium Point, we're the building down at East Side, and we're in a landlord, we're in an event space, we're a public building, we're a charity. So we're quite multifaceted. And so when COVID-19 reared its head back last year, I'm sure we faced all the same questions that everyone who's listening today were facing. So it was like, how is it going to affect our business? How's it going to affect our events business? You know, are our tenants, being a landlord, are they going to cope financially? What does this mean for us as a charity at a time when we knew that we were probably going to end up being wanted more now, as things were getting tight for people? And what really overrun everything, especially at the start, was how do we keep our employees, our tenants, contractors, visitors, everyone who enters this building, how do we keep them safe? Because at the start, we didn't know how long this was going to be, but what we did know was that we had to keep people safe, because the worst case scenario was, you know, lifelong illnesses or even death. So it was really, really important. It was something that, you know, a pandemic that wasn't on our risk register, but actually it is now, and how we deal with that. So it was something that our generation just hadn't faced. So we needed to see how the situation was going to pan out, and we were looking to China, and we were seeing them coming out of it within 12 weeks, and we thought, well, we can sit this out, but actually what we can't do is be laid back. We have to keep people safe. And presenting, you know, preparing for today, I was thinking, actually on reflection, we moved really quickly when it came to public safety. Again, looking to China and seeing it all coming Christmas and January, and we actually had hand sanitizers installed at Millennium Point as early as February, and they were there, very prominent. What we did find though was that by the time March came, they were being stolen, so we did have to pin them down a bit. But for us, it was really important to keep people safe, and we had increased cleaning even in the February, because we knew that was something we could do. And it was all for us. It was about not only actually keeping people safe, but making people recognise that when they walked in, they felt safe. So seeing all of those safety measures in place gave people confidence when they were walking around, seeing the cleaners out all the time. So it was really important to us. And then we looked to our teams and we could see what was coming down the line, and we had luckily invested in cloud-based technology. So we mobilised our team really quickly to work from home, and actually we were having people at home prior to the actual lockdown in March, because we had a real fear. We had a fear for people's safety. We didn't know what we were dealing with, but what we knew we could do was to take control and put real good safety measures in. And seeing people leaving that day, it really did hit home that, my God, this is a real scary moment. And I was just, you know, without sounding really morbid, I was thinking, I hope that I get everyone back at the end of this, because it was quite scary. But I guess as a building and as a business to us, being a landlord, being an event space, actual public health is really core to what we do, and just safety as well in terms of being in this building. So as I said, we work really quickly because that is kind of central to what we do, keeping people safe. So we were one of the first really to come out with our 5-point client protection plan, and that implied not only to events but to our staff and to our visitors. So we knew we had to get this right, you know, it had to be done properly. So our 5 points, you know, space and social distancing. So we made sure we had clear signage, one-way systems, people felt safe when they came in the building. Hygiene and cleanliness was the other thing. We had sanitising stations everywhere, as I said, deep cleaning every day, constant cleaning of handrails, everything was being done. PPE was available around. We even sought things like self-cleaning buttons to put on anything that people could touch, so that when you came in here, you felt absolutely safe. We had clear and regular communication with everyone, and I think if I was to reflect on what's come out of the pandemic, is the real importance of communication. Communication with your teams, communication with your visitors, with your stakeholders, to make people know what you're doing. You know what you're doing, you know you're in control, but that needs to be communicated out to everyone. So real strong communication links. The other thing we brought in was enhanced technology. We could see that the events business was going to close in those early days, and it eventually did. How could we keep that connection? So we invested in live streaming to be able to allow delegates to still hold events, but through that live streaming. And I do think that will remain, an element of that will remain, because it opens up lots of opportunities. And then in terms of our events business, a contactless service, we looked at every point where a client or delegate had to touch something, and how could we make that as safe as possible. So cashless bars, contactless catering. So long gone now are the days where you go to a buffet and you choose things. Everything now is individually wrapped so that people can take that and don't have to touch anything. And I think that's a way forward really, and that's worked really well. The other thing was putting our website, virtual tours. People didn't need to come into the building. They could go and look on the website and see what was on offer. And all of this was put into a video so that people, before they came to the building, could look at that video and see everything that we'd done. And I think, again, what I said was, it's not just about actually keeping people safe, it's communicating that your safety is an absolute priority to us. And that's what, you know, those are the things that we were doing. In terms of the business, as a building, a public building, we couldn't close down completely. We have obligations to health and safety executive. We have, our tenants needed to come into the building if they needed to look at their spaces, even though it was closed to the public. So we took that time to do essential maintenance, do things that we were putting off until it was a quieter period for us, and we used that. Again, we had contractors at the site, we had engineers, security, cleaners. We have to keep them safe. So it wasn't a case of closing down. Our cleaning regime continued and continued, and where we could improve that, we improved it. So that was really important. For our events team, you know, what were we going to do there? We were looking at, well, let's give clients flexible booking policies. Let's work with our delegates, especially those who had already had bookings, you know, to make them pay the deposits. That's not good for anyone. One of the things we were really keen on was working with our suppliers, with our delegates, to make sure that they could also ride out this pandemic. So we became very flexible, allowing people to move their events and working with them and being really, you know, how can we help you move forward, and how can we help you still communicate out what you want, but in a safe way. So we worked really hard to think of other ways in which we could help. What really came out of the pandemic for us was diversification. What I was so proud to see was that our team, how they looked at, this is the situation, this is what we can't do, what else can we do? And they were things that we talked about for many years, but we were so wound up in our events business and the current work that was coming through, you know, it was like, well, we'll hold that for another day. But what it done for us was to give us time to think outside the box. And how can we do that? We always wanted to open the cinema again, do live gigs, work in the leisure sector, and this gives us that opportunity. So when the cinemas opened up, we reopened as a cinema. What we've now come out of is the pandemic with a whole new range of facilities and services that we can apply to new audiences. So we really embrace that, and thanks to the team really with their entrepreneurial mind and outlook, and that's a big thing that's come out of this, is empowering your team. So we've got all of that coming through, and now we're coming out of the pandemic with that as something we can use to prosper. And you know, diversification, you can't get any more than having a mass vaccination centre in the building, which was, you know, absolutely wonderful to have and to be playing a part in getting the city back on track. And you know, one of the things, because we put so many measures in place, it was easy for the NHS to come in because the cleaning, everything was here for them, the infrastructure was here, so that was great. In terms of our employees, you know, we mobilise them from home. I have an absolutely great team, and I'm sure people out there will be thinking exactly the same. At the time, you don't want to lose the team that you've created. You know, how can you keep this business going so that they have jobs at the end of this? And we worked really hard with them, and thankfully the furlough scheme came in, which was amazing. But we didn't rely solely on the furlough scheme. We used the opportunity to second events team people into other parts of the business, into finance, into people learning development. And what I've come out with is a team now that have a real broad range of skills, and I've still got my team, and so I'm really pleased with that. So we always look for different opportunities whenever we were faced with another challenge, and let's admit, you know, every week the goalposts were changing, so we had to move. In terms of looking forward and how we prosper, you know, as I said, we've diversified into various different service lines, which will only protect the business further going forward, and really exciting things. And we've invested heavily in our new auditorium. So that's important. As an employer, I'm really conscious that it's really important to have social interaction between your team, and when you're bringing new employees in, how you train them. But actually, I don't think that should be a barrier to having a better work-life balance. And I think something the pandemic has shown and taken down those concerns, they've removed them really in terms of people working from home. And I think it's all about balance and working within the measures that you need to still run your business, but having people working from home. And, you know, I've always championed this output, not input. And what I found in the pandemic, and I'm sure other people will share that, is the fact that people probably delivered more at home because they had that better work-life balance. And it all comes down to trust. And what the pandemic done was remove those barriers and say, well, you're going to have to try it. And it worked. And I think if you go down the output versus input route, people who don't adapt, they will come to the top. But I think if you can really trust people, then, you know, it's up to them to retain that trust. And luckily they have. But I think that work-life balance is definitely something that we'll keep going as we go forward. In terms of our event space, as I said, you know, we've expanded our venue spaces and adapted, and that's something I'm really excited about. Pandemic also brought up the issue of sustainability and CSR. That's really come out. People saw the period of time where everything stopped and how everything, you know, the environment, etc. What we're finding now is that people who want to come to us for conferences, or people who want to come for us to having a unit, they want to see that we're sustainable. They want to see that we are looking at net zero carbon. And I think that's something that businesses really, you know, if I was to look at the challenges going forward for businesses, is technology and the green agenda. And I think what the pandemic has done is really accelerated that thinking in terms of sustainability. People will be asking those questions if they want an event in your venue, or if they want to be a tenant in your building. And you know, that's something that we've also worked really hard at. And then as a charity, it's been probably the biggest challenge because it relies on our profits. But what it has done, we've turned in a challenge into a real opportunity. We're here to support science, technology, engineering and maths. And I think it's quite easy to see, you know, it was so clear from the start that those people in STEM, which we call it STEM careers, you know, they've kept us alive, they've kept us healthy, and they've kept us connected throughout this whole pandemic. And without those careers, you know, I dread to think what the situation would be. We're here to support that. And, you know, it's really given us that drive now to push that forward. And we've brought industry and education together to really drive those careers for young people. So we've taken a real bad situation and really taken the benefits out of it and the positives and move that forward, you know, to get people into those careers. So really, as a business, you know, we acknowledge that the last year has been a real challenge and really horrendous. And I've got colleagues here who've lost loved ones, and it's been a very, very difficult time. But as a business, we've diversified, we've got better work-life balance. It's allowed people, the team here, to feel really empowered, and I've had some amazing results out of that. But I think we do still face challenges ahead. For us, what will tenants of the future require, especially if we're home life back, you know, people are working from home? What do they want? What, to us, tenants will probably want more than what's on the table now. If they want to come and work in the city centre, they want something that is better than what they have at home. So, you know, what does that look like? I think that's still a question that's up in the air. Technology, the pandemic has really pushed technology probably 10 years ahead of what it would have been. And for us as well, what will the technology be for the future? As a business, will we have to invest in new technology? What's around the corner? So that's another challenge for us. I think public health, I think hand sanitizers, being really vigilant, I think it's with us for a very, very long time. You know, what additional cost is that to a business? That's the challenge. But just like we have to have a fire alarm system in this building to keep people safe, it is just another cost that we have to absorb. But that's a challenge for lots of businesses. And I guess employees, work-life balance, you know, making sure we retain that culture going forward that we've adopted in that way. And then the other thing is safe travel for employees. I see that as a barrier to people coming in. But all in all, they're challenges that we can see, and businesses as a community, we support each other on ways to deal with that. And that's how we've been at Millennium Point.
Abby, thank you so much. Really, really fascinating. I think there's so many points that you've raised in there which will resonate with so many of the attendees on the webinar today, particularly around the importance of communication, diversification, investing in technology, but also thinking about not only the opportunities, but the challenges on the horizon as well, and how as a collective business community, we adapt to those moving forward. So we've got just under 20 minutes or so for some questions. So I'll give the audience a couple of minutes to think of any particular questions they might want to ask. I think there's one in there already, but I just wanted to ask a couple of quick questions myself. So Abby, I'll start with you as you've just finished. You mentioned obviously Millennium Point have got so many different hats and they specialize in so many different areas, but what would you say has been the most challenging aspect of the past 15 months in relation to implementing COVID-19 safety measures?
I'd say all of them have been challenging because you don't know what you're dealing with and you're keeping, you know, everyone safe because we've got so many people. But I think the biggest challenge was the NHS, the mass vaccination centre, bringing them into the building in a safe way that was safe for everyone. And it wasn't a case of just Millennium Point and the NHS, it was Millennium Point, the NHS, the tenants, Birmingham City Council, because when you have a vaccination centre, it's parking, it's how that impacts on the city in terms of cars and logistics. So that was a huge challenge because it had to be right, it had to be safe, because you were bringing in 2,000 people a day into the building. And as an employer, I had contractors, staff, everyone else in the building as well. So it had to be right. And so that was a big challenge. But it also showed that everyone working together for something so important as public health, and it worked, and it's been a success. So.
No, completely. I mean, just out of interest, what kind of turnaround time did you have to put the steps in place to have, you know, thousands of people in the building at such short notice?
It was very quick. It was about 4 weeks.
Wow. Wow.
But that's because it was moving so quickly for themselves. And, you know, when you've got an organisation like the NHS, it's a huge organisation, and then what they've done was absolutely amazing. But it had to move really quickly. Yeah.
Completely understand. So a couple of questions have started coming in. So Julie, if we can come to yourself first. So Denise Burgundy has asked, after the 19th of July, will you still need to follow any COVID rules when we return to the workplace? Now, again, I'm guessing a lot of this is going to be down to the announcements made by the Prime Minister and perhaps the new Health Secretary today. But Julie, do you want to come in on that one?
Yes, certainly. As you rightly said, Raj, yes, it will depend on what we're told, you know, from the government. But I would suggest, based on what we're currently seeing, I mean, I don't think we would actually get to a zero case rate. And I would suggest that people still maintain the COVID safety rules as much as they can, especially when they're outdoors, and basically stay safe.
Yeah, no, thank you for that. And I think we've had a similar question, which was asked by Joe Jones earlier on. there's been guidance issued last Thursday to limit movement in and out of the city. I think this is referring to the fact that Birmingham's been designated an area of enhanced support. This came on the same day that travel to green countries had been granted. Quite a confusing message. What is the stance on travelling into the city centre for work, for example, given that areas of concern are central? Julie, do you want to come in on this one?
Well, there are lots of discussions going on, so it's not a clear-cut answer. However, we did, because we are involved in the enhanced support. We have, the advice is that people should limit their traveling in and out of the city and only travel out if it is absolutely essential, so that we do not only spread, but also bring in more cases. And so that's as far as I have had any communications around that. There's still a lot of discussions going on around the cities around what people are meant to be doing in terms of travel and things like that. But it is still, there is no clear decision yet. It's still an ongoing discussion. And in the moment we get to hear the final thing, we'll let the businesses know.
Of course, and I think that's one thing that we pointed out last week, that these are recommendations made by the government as opposed to regulations. So that means the associated support that those businesses that are affected by this, it's just not there right now. And that's obviously something that we highlighted last week as well as an area of concern. Abby, question for you from I think Major at 5up.co.uk. Can I ask Abby if Millennium Point have the contract to supply goods to Birmingham City Council, like traffic cones, painting zebra crossings near roundabouts and bus stops?
No, we don't.
No, I thought that was going to be the answer.
We don't make any goods or supply any goods.
No, thank you for clarifying that one. We've had a couple of other questions come in, and again, this is, I think, open to both speakers. But do you think that many businesses that are office-based will go down the route of requiring staff to prove they are vaccinated before they're allowed to return to working in the office? Again, I'll open it up to both speakers on that one.
Repeat that again, Raj.
Sorry, we had a question saying, do you think that many businesses that are office-based will go down the route of requiring staff to prove they are vaccinated before they are allowed to return to work in the office? Now, again, I suspect a lot of that's going to be dictated by government.
Exactly. But I think what will continue will be people will have to test before they go to the office, so that they maintain a safety not just for themselves but their colleagues and families and all that. So that's what I'm certain about. But I think we will wait for guidance from the government on that particular aspect of what you just talked about.
Yeah, I think that's a huge step. That has, huge employment law issues. So I can't imagine that will happen overnight. But in terms of, testing, if you feel, we're very clear with staff that if they feel poorly, don't come in until they're tested and are safe, because that one, person in the office can completely change the whole situation. So it's all about being sensible.
No, completely.
And taking responsibility.
Yes, as you mentioned in your presentation, Julia. I mean, we've had a question from Claudia, which is, what is the advice for how employers can encourage their staff to keep up testing and vaccination? So I guess there is that kind of element of testing fatigue, perhaps. Stressing the importance of people testing twice a week. Is that something that you've seen or picked up any anecdotal evidence in relation to that, either Julia or even Abby, when you've been speaking to your staff members?
Yes, we've seen that, but the important thing to note is that the testing itself is important because it allows you to identify whether you have COVID or not. And and when you think about the fact that you are likely to go ahead and infect other people, you have that responsibility to ensure that you identify that you are COVID positive and then stay isolated. Mm-hmm. Now, the thing about it is that there's been a lot of concerns that, people might feel that they will lose their income based on that, but there are support systems around to protect them. And I did put the link. So if you do identify that you are COVID positive, you need to inform your employer, and you also need to inform the allow the NHS to know that you are positive so that you can then have all the other supporting support that you need. And I put the link in on the slide as well.
No, thank you, Julie. And what we'll do is we'll share the slides and obviously all the links after this particular webinar finishes. I mean, one question I had for you, Julie, was throughout this process, I mean, have there been any misconceptions on COVID workplace safety that, for example, in relation to test and trace that you've come across from different businesses in the last 15 months or so?
Not exactly sure what you mean by that. Are you in terms of testing or contacting the contact tracing team?
Yeah, it's more just if there's been any kind of erroneous information or any kind of concerns you've had about, how the test and trace program works. Is there kind of misconceptions of, why it needs to happen or how businesses can get involved? I mean, what we're finding is that sometimes there does seem to be a disconnect between the guidance on offer from the City Council and how certain businesses interpret it and their understanding of how to interpret it. So that is more relation to that, really.
What I would say is that we have a process in place where if people are identified, then they need to contact the contact tracing team who will then support them. And there's also a link with environmental health officers to ensure that there's an enhanced contact tracing and they are maintain their social isolation. I think what we found out was that people were a bit fatigued about the testing, and there needed to be more information raised around that, encouraging people that it's not just, they need to do this testing. That's the only way they can identify that they are positive. But also it is not, I mean, the other thing was that people might think that because they've been vaccinated, they shouldn't do the testing. But we don't know how this Delta variant will turn out. So we need to know, based on the fact that you've had a vaccine, 2 doses of the vaccine, you need to do the test so that we can see whether the virus overrides the vaccine. That's one of the reasons why people should continue doing their testing.
Yeah, very much so. I think related to that point, we've got a question from Carla Goodfellow who says, at present, you cannot enforce vaccination or testing. Do you think this could be changed legally in the future? I mean, again, a lot of this comes
I can't answer that
down to government guidance, isn't it? And that's something that's people asking those types of questions. But yeah. I mean, I guess one question from me was there any element of enforcing some of these procedures that you found particularly difficult, or where it wasn't particularly clear on the guidance or how to go about making some of these changes?
I think one of the environmental health officers have been very helpful in that. So they go around and where there's been cases, they've gone in and supported the whether it's workplaces or households, they've gone there and supported them, answered questions, and signposted them to support services that they require. So we do have that communication going on. But one thing I would like to add to this is the fact that we're trying to encourage businesses to become COVID champions, so that they can, provide information to their other colleagues and actually, get first-hand information and updates and guidance, and then pass that on to the respective employers. So that would be helpful if people could, volunteer to be COVID champions.
Yes.
Yeah, we've always taken the guide. We really, every time something changed, we'd really get to understand it, speak to our industry, institutions, speak to yourself, speak to other businesses to make sure we're getting it absolutely right. And there's been no, people understand why you're asking them to do certain things. So, the challenges we could see coming up, especially when we opened the cinema, and it was at the time where 6 people could be together, but you couldn't, it all had to be done at a table and they couldn't mix and manage. The team knew that if tables started to mix, that had to absolutely stop or leave, because it's too important. It wasn't, we couldn't allow the rules to be bent in any way. And that is a challenge because not everyone feels that way, but as a business, that was really, really important to us, including face masks. We imposed face masks in the building quite early on, You couldn't come in unless you had it. Even our lifts now, it's 2 people in the lift, and that is it. It's just too important to risk. So, but I have to say, reaching out to colleagues in other industries, in other businesses, and the chamber as well, you know, to understand what we needed to do to get it right. It had to be right, and we weren't willing to take any risks at all.
No, I completely appreciate that.
My main concern, actually, Raj, is the small businesses, single-handed businesses.
Yeah.
And the support that they need to be given.
Yeah, you know, we've done some work with yourselves, Birmingham City Council, on this, and speaking to a range of different businesses, and some of the larger organisations have a designated staff member who can keep on top of the latest legislation, how that's applies to their workplace. Some of the feedback we got from the smaller organisations was that you know, they're just trying so hard to kind of run their day-to-day business, but even having to be able to stay on top of these changes, where to get the information from, how to interpret